everybody.
Hi, Internet. So, it's been a few days longer than normal since our last update. That's just because when we would normally post an update was falling right in the middle of a lot of stuff going on. So, yeah. So what has been going on recently? So we've been kind of working our way toward it for a while now. Well, I think she's working on something right now, but as you can see, Aria is no longer intubated, technically. She, on Monday, she had surgery to have a tracheostomy. So her breathing tube now goes directly into her trachea from the outside. And then she also has what's called a G-tube put in, which is how she gets fed now. And this was a difficult thing for us to go to because, of course, we don't want for our little girl to have surgery. But it will improve her quality of life immensely, and it is temporary. This is not something she'll have for her whole life. They're telling us to expect anywhere from 1 to 3 years. Really, initially they said 1 to 2 years. The third year is just kind of included in there as in case there's unforeseen events that come up. But yeah, by the time she is 3 years old, should be done with all of this and good to go. The reason for this is when she was born, her lungs were underdeveloped. She was born 12 weeks early, and she was actually considered small even for that stage of development. And so at first she just needed a lot of breathing support, and then she got a bacterial infection, and that set her back really far on the progress that she had made. And she's had a couple of other infections since then. And basically, she's just had to be intubated for so long that her lungs went from being underdeveloped to instead now they're just damaged. Her lungs are developmentally not... The development's not the issue. It's just that the tissue damage is there now. And it's just something she has to live with for now. As she grows and gets taller, or longer because she's still horizontal, as she grows and gets taller, her body will produce new lung tissue to fill in that space and expand her lungs, and that will let her be able to come off of this machine. It'll make it so that she no longer needs it, and she'll develop like everybody else from that point. This is just to get her to that point. And so this was the way to still give her the machine support that she needs while getting everything out of her face and letting her be able to... I'm not going to do it right now because she's asleep, but she's able to turn her head now. She doesn't have to stay still all the time.
And we can come in and pick her up and interact with her without needing 2 or 3 other nurses to help us.
Yeah. And she'll be able to learn to sit up and to crawl and to walk and all of that, which is all things she would not be able to do with the tube going in through her mouth. Yeah. She would have had to stay very still the entire time that was in there. But yeah. But earlier today she was awake and looking around, and she was happy, and we haven't seen her both awake and happy in several days. Including the whole week before the surgery. She was just constantly agitated and angry about all the stuff that was taped to her face and having that
now
tube
you can
going
see
in.
Her face.
I think she is working on a diaper right now.
Yeah.
Oh, goodness.
She's got...
Hey.
She probably has a lot of air from the surgery.
I was just talking about you being happy. What are you doing this for?
She's got to show off for everybody. Do the exact opposite of what we say.
Typical child. Her face still is a little bit swollen, but it's a lot better than it was yesterday. There's a reason we didn't do a video yesterday. She did not really look like our child when she first came from surgery.
Which her surgery was on Monday, but it's taken a few days for things to be more normal.
She's fine.
Yeah, she is fine. But yeah, she's, as far as her numbers and everything, she's doing really good. She's on 37% oxygen, which is awesome because she's moving around and still like lower than she had been.
Yeah, she seems a lot more comfortable.
Yeah, she does seem a lot more comfortable, and like her heart rate is staying more normal than it had been and everything. So, yeah, she's doing really good.
Yeah, and again, I want to say, like, this wasn't an easy thing for us to accept that she needed it. Of a lot of prayer, a lot of seeking advice, seeking input from people who have had it done, or people who tried not to do it for a while and eventually had to give in because it just, being intubated really is not a long-term thing. I'm taller than you are.
Yes, you are.
Yep. I've not been able to have a haircut recently with us, how much time we spent at the hospital. But yeah, just being intubated is not a long-term solution for a developing infant. It would hinder her more than it helped her in the long run. So in the end, as painful as it was to accept, this is the better option for her. She'll be able to develop a lot more with this than with the other option.
The way I like to say it, she'll basically be able to be a baby now.
Yeah.
And develop like a baby and all the good things.
Plus now I can have all the little baby pictures and when she's older convince her that she was like an alien cyborg or something. I don't know, I'll find some way to mess with her when she's older.
Oh yeah, it's gonna be great. But yeah, her G tube, her feeding tube, that is not going to replace everything. We're gonna, of course, we want to teach her how to eat and everything. That's the plan. It's just there as she's relearning everything, because that tube is going to create a lot of aversions for her because it was really uncomfortable.
Or rather, it has created.
Yeah, it has created. So we have to retrain her basically how to eat, swallow,
we have to teach her that things coming into her mouth are not always negative, and this will let us be able to feed her until she... we promise her eyes do open. She's just knocked out right now.
She was moved. There we go. She's moving a little bit. But yeah, she was awake, eyes wide open earlier, and just chilling. So, but yeah, this is her, and she's doing really good. Doing real good.
Still a little swollen, but she's ours.
And they just turned off her, oh gosh, what are those?
Her IV sedatives.
Her IV sedatives, and they're...
So after surgery, she was on morphine and one
Versed?
other... Yeah, Versed. And they just turned those off and switched her back to some less intense sedatives just to get her through until everything feels better.
Yep. And she's on Tylenol and some other things I can't remember at the moment. But yeah.
Yeah.
That's our video update for you guys.
Oh, Aria's trying to wave goodbye.
Is she? Here we go.
Well, she was just scrunching.
Say bye, Internet. We love you guys. Have a great evening.
Say goodnight, Aria.
Good night, Aria.
Not you.